Hello and welcome back to the Healthy Elkhorn podcast. This is one of your hosts, Dr. Erickson, along with my co-host,
Dr. Jake Anderson.
So here we want to talk about as all things health, wellness, fitness related, along with, what can you do to improve not only mechanical pain. In this case, we treat a lot of spine, neck, shoulder, back, hip, that kind of thing, even post-surgical things for the joints as well. But what else can you do after, those injuries or those problems to get yourself as fit as possible, as strong as possible, bring back the confidence and that kind of thing. And then, so today's episode, we want to talk specifically about what a doctor's visit episode, should and shouldn't look like. So if you leave your physician's office, whether it's a family practice physician for the first time you go in, you're having back pain, neck pain, whatever it is, or even a spine surgeon or somebody else. Well, heck, it could even be one like us, a PT or a chiropractor, some visit where if you're leaving more fearful, the big words that they use, more confused, more scared about movement in general and what you should and shouldn't do, and really have less clarity than when you started. Than when you went in and you're looking for answers, then you need to find a different provider. Let's kind of go off of that. And what would you say that would look like in this situation?
Yeah, so we're going to kind of paint a little picture here. So the typical scenario that we've heard way too often, it's actually pretty sad, is that, the patients will get funneled into a doctor's office. The doctor will spend 5 minutes with them, maybe ask a few questions, maybe do a couple tests, but then they get sent immediately for an image, X-ray, MRI, something like that. Then they'll get offered, some sort of medication and told not to do something for a long time.
And that's maybe if they even move you around at all.
Yeah.
Rather than just barely look up from a computer or a notepad, they're just taking a few notes on their computer for their obligatory insurance. They have to do documentation. But rather than that, it's 5 minutes and here's the test and then medication to use.
And then some of the things they'll come and tell us with if they see us after that situation is, oh, my doctor told me that's the worst I've ever seen. That's the worst I've ever come across in all my years of practice. You shouldn't, go run anymore. You can't ever lift weights again. You will never be able to go back to, playing basketball.
Yeah, whatever your favorite activity is and things that you want to be able to do again.
Yeah. And it's sad because the way, as doctors, the words we use and then how we phrase that to the patient actually plays a big role in how the patient can respond to treatment and their beliefs in and of themselves.
Yes.
So how often do we see that?
Let's talk about that a little bit on the. Now there's a biological or a physical side.
Yeah. Okay.
There's also a psychological side, and really the best way to treat and help people is in that biopsychosocial model. So there is biology. Obviously, we're trying to take care of the tissues that may be injured. Yep. But like you're saying, if you fill someone with fear because there's words they don't understand: herniation, protrusion, extrusion,
osteophyte,
annular tear, all those things that for many times are not, stenosis, all that kind of stuff that can be general, normal, age-related changes and may actually have nothing to do with the pain they're having whatsoever. It's just a picture, just a finding. Well, then that spirals and snowballs into, well, I hurt and I've been told that I have this problem, so I'm going to do even less because I don't want to aggravate that thing. And then by doing less, then I'm even more deconditioned, and then I hurt even more, and then it just spirals out of control the other way. And that it actually makes them worse, and it inhibits their ability to heal.
And keep in mind, these patients, especially if they have an image, they might be reading all these terms on the report. And oftentimes, doctor language is much different than patient language. Yeah. So what you read on a report is all doctor language for the most part. And you see those big scary words, degeneration.
And they usually don't explain it at all. They just give you, and you got to remember, the radiologist that has never seen you, doesn't even know your name. Yeah, they're in a dark room somewhere with these big screens, just writing a report of what they see. They've never moved you around, never interviewed you. They don't even know what side hurts. Like they have no idea. They're just paid to interpret an image, and write a report.
Yeah.
I-
So all these words can be very scary, very off-putting. They make you worried. And as a patient, you don't know where to go. You just go, okay, if I'm not supposed to, run, if I'm not supposed to play basketball, I just won't do it because I don't want to hurt myself worse. I don't want to tear something more. I don't want to bulge something.
Well, and that pain can be very
Yeah.
debilitating. I mean, it's not fun to have that. So I know you don't want to go backwards. You don't want to feel like that again, but not knowing what to do or what not to do, then the easiest solution in everybody's mind, because we're human, is just to not do anything, because I don't know what will be better or worse. I just won't do anything. And by definition, by not doing anything, that will then make you worse.
And one of the biggest things to understand is there are no absolutes in the world of musculoskeletal health, which is where PTs and chiros live all day long. So one person might have a really bad herniation or whatever, and we can't say for sure that you will never run again. The only way to know is to test response, have them run a little bit, see how they tolerate it. If they can't do it, okay, let's change that. Let's modify that temporarily and try and build you back up. If you break these injuries down and the rehab process down into smaller bits and build back up to where they were before, oftentimes, actually probably 95% of the time, we can get people back into their activity, back into their routine, back to performing at where they were pre-injury level. So, we just have to gauge that.
And also even some of the treatments that, like you said, no absolute, some things that people are asking, they're out there in different groups and we're a part of a lot of groups and we're a part of a lot of, we try to help as many people as we can.
Dr. Google.
And we try to dispel as much misinformation as possible, but what helps or hurts someone doesn't necessarily mean that it would be better or worse, for you. So someone, and the one, and you can speak to this more, but the one that's the easiest is just the chiropractic. So if someone puts a post out there that says, should I go to a chiropractor for my whatever it is, neck, shoulder, back, hip, knee, elbow, whatever, there will be 50% that will say, oh my God, never, don't ever do that. It's the worst possible thing you could do. You'll leave paralyzed and all stroked out. And then there'll be half that'll say, oh no, it was great. My chiropractor really helps me. And it was, that's an extreme example, but that's the one I see most often.
That's a super common one.
It depends on who you see. Obviously who you see is a very big part of it. Your own belief system, if you go into it believing it's going to work and not going to work, that's going to be a big, part of it. And then, just what you have going on, as far as your injury and problem, if they don't have the ability to adapt and try some different assessments and techniques and that kind of stuff, it's not a one size fit all for any of these things.
No, and it's okay as a patient on your end. You should want to seek multiple opinions. You should want to get, especially if you're not getting the answers or you feel more confused or you feel more fearful, you should definitely reach out to a different provider, maybe even a different field. If you went to a chiropractor, maybe you should talk to a physical therapist.
Yep.
Maybe you should talk to an ortho doc, whatever it may be, but you should seek other opinions.
Multiple, yes.
So maybe let's paint the picture of what a good interaction with a provider would look like. So if you come in, they should initially meet you, greet you, take you back to the room. They'll take a history. They'll ask you the questions specific to, how did this occur? How is this affecting your life?
There should be a lot of questions.
There should be a lot of questions. What things have made it better? What things have made it worse? Where do you feel the symptoms? When did it start? A bunch of things. And then
what have you tried so far?
Yeah.
What have you noticed that, like you said, position, movement, time of day, activity, posture, what exactly do you feel? Is it is it constant? Is it intermittent? Does it move? I mean, you got to ask a lot of questions to figure out, to get a basic understanding of what's going on.
And they should be asking you what are your goals, and then make those goals part of their goals. Mm-hmm. So the doctor, the patient should be on the same page for what the goal of the treatment is to be and how they're going to get there. So the patient should be just involved in the treatment plan as the doctor is. And then from there, you should get more than a 2-second, oh, I moved your shoulder around. Mm-hmm. Okay, we're going to go get a picture of it. There should be a more thorough, in our case, always rule out the spine first.
Objective measures, tests, measures, movements, get a baseline, try different, repeated movements, what's changing, what's improving, what's getting
tests
worse.
And retests, a lot of tests and retests. And then from there, you can kind of gauge where treatment would be, whether you need further imaging or anything like that. And at least in our case, in the world of what we treat and see every day, we rarely need to send for any imaging, and we rarely, very rarely need to send out for surgery.
I mean, some examples would be like, and it's usually, I wouldn't say fairly obvious, but there's a lot of times when we know that, okay, if we're not making some significant changes,
And it should be quick.
oh yeah,
like
over the next,
4 to 6 times,
yeah.
4 to 6 visits.
so 2 weeks. I mean, we see it for a couple weeks, and you're working on things, and there's really no change, then we know that, okay, let's probably get another, a picture to give us some more information. We're not saying that I think the common thing is people say, oh, I need to get this MRI or this CT scan or this or whatever to figure out what's causing it.
Yeah.
It's just information that's part of the entire case of what we're building, to know what's going on. But in no way does it prove, or disprove, always. Sometimes it does. Like, we had a lady here not too long ago that, back pain, leg pain, classic spine disc type thing, right?
Yeah.
Change it temporarily, then not change. Change it temporarily, then no, so a little bit better, then no better, a little bit better, then no better. Okay, over the course of a couple of weeks, we're like, okay, well, something's not adding up here. There should be, we could get changes here, but she was not able to keep those changes at home, right?
Yeah.
So in this case, yes, go get a picture. And it did show something then, in this case, sinister, not good, right? There was a cancer inside of the spine and inside so,
Yeah.
I mean, so there's a reason why that pain was there, and it correlated well to that, because it did not change and it was constant, and all these red flags started coming on. But for the most part, that's a very rare thing. This is like once every couple, every couple of years would it be. The vast majority of people will have change right away. You're on the right track. You're making progress. There's no reason at that point to then get any kind of advanced imaging or spend the extra $1,000 for something that just doesn't need to be, that could just send you into more fear, a fear loop.
Yeah. And then the doctors you're working with in the good scenario here too, they should ask you if you have any questions. And then if you have any questions, they should provide you with meaningful answers, explain anything you don't understand, explain why we're doing this, because we want to try to make this happen. And then we want to see you progress this much, gain this range of motion back, whatever it may be. But there should be specific goals. And if you have questions, they should be answering those. So I think that's a good little cap. Is there anything else you want to add on there?
That's what a visit shouldn't look like, and what a visit should look like. And if you have those visits like that, like Jake said, don't be afraid to reach out to others, ask people, who have you seen, and even, and I guess, I use the chiropractic example as the kind of divisive, like, yes or no, 100 people, 50 will say yes, 50 will say no. The other one on the PT side is, they have a pain or a problem, and they say, well, I've tried the PT, it didn't work. Okay. It's not all physical therapists are the same. Not all treatment is the same. Not all approach, I mean, there are, I don't even know. I mean, hundreds of different, kinds of not only physical therapists, but specialties, and the way they approach the problem. Yeah. So it's, and even the timing of it sometimes, like, we've seen where certain movements at the time when they've tried them in the past didn't work for them. And then when we do them, the second time, months later, all of a sudden they were like, well, no, that didn't work for me. Okay, we'll try it. Oh, it does work this time. So sometimes even just the timing and the healing, the process, the body has changed over a little bit of time. So don't give up, keep trying, keep looking for a couple of different, opinions and that kind of stuff. And if you do get disenchanted or you're frustrated with a provider, you can always find, another one.
Yeah. And just remember, just because in our case too, we say this all the time, just because we have doctor in front of our name, just because the doctor you're seeing has doctor in front of their name, doesn't mean they know everything. Nope. And it doesn't mean we have all the right answers. Nope. So yeah, it is perfectly acceptable for you to question and be involved in what's going on. So
yes, please.
Yeah.
That's a good sign of an educated, patient, is someone who's proactive and looking after their health and asking questions about why are you doing that, what's going on. That's a great patient to work
and
with.
education is just as important.
They're going to work harder anyway, because they already are. involved and invested in their body.
Yeah, and part of the treatment that we give, I mean, education should be part of that, not just the physical, hands-on care and movements that we provide in the office. Educating is just as important so the patient understands what's going on and how we're going to get better. So cool.
Yep. Thank you very much for joining us. We really appreciate everyone that listened. Can't tell you how much that does mean a lot to us, that you take the time, your most precious resource time, and give us that time to listen to us kind of talk about subjects. But we do this to help as many people as possible. That's the whole goal, is to get information to try to help as many people as possible. So if you can, like, share, tell others.
Let us know if there's any topics you want us to hit on, anything you're interested in, any specific questions you might have. Give us a little prompt and we can put a little video together and try to answer it as best as we can.
Okay. Thank you, everybody.
Thanks.